Good morning, it's March 24th, and this is your daily brief in science. Here's everything you need to know. The H5N1 bird flu virus has made headlines in the UK with its detection in a sheep in Yorkshire, marking the first instance of this virus in the country. This case was identified during a routine livestock check on a farm that has previously faced avian influenza outbreaks in captive birds. In response to the detection, the infected sheep was humanely culled for extensive testing, as confirmed by the Department for Environment, Food and Rural Affairs, or DEFRA. Dr. Meera Chand from the UK Health Security Agency noted that while mammals can contract avian influenza, the risk to the general public remains very low. The UK government has stated there is currently no evidence of increased risk to the overall livestock population following this isolated incident. UK Chief Veterinary Officer Christine Middlemas has emphasized the importance of vigilance among livestock keepers regarding signs of avian influenza. To contain the virus, DEFRA has established an avian influenza protection zone across England, implementing mandatory housing measures in 13 regions. Despite ongoing concerns regarding bird flu, authorities in Louisiana have reassured the public that the general danger of the virus to humans remains low. Currently, there is no vaccine for bird flu, and preventive measures include avoiding contact with sick birds and ensuring poultry and eggs are properly cooked. The UK Health Security Agency is closely monitoring the situation and has preparations in place for potential human cases of avian flu. Experts suggest that the sheep's infection is not unexpected due to close contact with infected birds, but further research is needed to assess potential onward transmission. The virus has also been detected in various wild mammals, indicating it spread beyond birds, which raises concerns about potential spillover infections into humans. A new study has emerged that could redefine how we manage cholesterol in high-risk patients. Published in Mayo Clinic Proceedings, this research identifies the combination therapy of ezetimibe and high-dose statins as the gold standard for cholesterol management. Previously, the practice was to wait 2 months to assess statin effects before adding ezetimibe. However, this study advocates for immediate initiation of combination therapy for very high-risk patients. Analyzing data from over 100,000 patients across 14 studies, the findings show that those on the combination therapy experienced an additional 13 milligrams per deciliter reduction in low-density lipoprotein cholesterol, or LDLC levels, compared to those on statins alone. This significant reduction increases the likelihood of achieving the LDLC target of under 70 milligrams per deciliter. The results also indicate a 19% reduction in all-cause mortality and a 16% decrease in cardiovascular deaths when ezetimibe is added to high-dose statin therapy. Additionally, reductions of 18% and 17% in major adverse cardiovascular events and strokes were observed. Professor Maciej Banach, the study's lead author, estimates that adopting this combination therapy could prevent over 330,000 deaths annually among patients who have already experienced heart attacks, including nearly 50,000 in the U.S. Co-author Professor Peter Toth emphasized that this new approach could improve cardiovascular health without needing new drug funding, potentially lowering healthcare costs associated with heart attacks and strokes. The study underscores the importance of early and aggressive treatment strategies to prevent complications and deaths in high-risk cardiovascular patients. Professor Banach calls for this therapy to be included in treatment guidelines for high cholesterol, highlighting its safety and efficacy. With cardiovascular disease causing approximately 20 million deaths each year globally, effective cholesterol management is crucial, particularly in regions like Eastern Europe and Central Asia, where high LDLC-related mortality rates are significant. Singapore is making a bold move in the field of RNA research with the launch of a $130 million initiative called the National Initiative for RNA Biology and Its Applications, or NIRBA. This program, inaugurated by Deputy Prime Minister Heng Swee-keat, aims to enhance the country's RNA research capabilities over the next 7 years, emphasizing its importance for the nation's health and economic future. NIRBA will be led by Professor Ashok Venkataraman from the National University of Singapore. His goal is to establish foundational research in RNA science, with applications that span health, agriculture, and synthetic biology. The initiative is designed to foster collaboration among institutions like NUS, Nanyang Technological University, and the Agency for Science, Technology, and Research, creating a robust research ecosystem. This initiative comes at a time when Singapore's biomedical sector is growing, contributing 2.55% to the nation's GDP, supported by partnerships with global industry leaders. Over the next 7 years, funding will also be allocated for training researchers, recruiting international talent, and sharing resources among local research staff. The COVID-19 pandemic has underscored the potential of RNA molecules, especially highlighted by the success of mRNA vaccines. As of the end of 2023, at least 25 RNA-based therapies have received approval from the US FDA, with over 125 more currently in clinical trials for various health conditions. NRBA will focus on 4 strategic research clusters: the impact of Asian genetic diversity on RNA biology, how RNA modifications affect immune responses, RNA transport mechanisms, and the effects and clearance of RNA-based drugs. While the primary focus is on human health, the initiative also addresses applications in agriculture, food safety, veterinary medicine, and synthetic biology. Singapore's existing strengths in genomics and precision medicine provide a solid foundation for advancing RNA-based therapeutics, with initiatives linking genetic ancestry to disease prevalence. To facilitate this work, a new 2,000 square meter research space at NUS will serve as a collaborative hub for researchers engaged in RNA projects, promoting innovation and development. Researchers from the Technical University Dortmund and the University of Duisburg-Essen have made significant strides in the field of acoustic metamaterials with the development of a new inertia-augmented relaxed micromorphic model. This innovative approach enhances the performance and understanding of finite-size metamaterials, which are materials engineered to have properties not found in nature. The study utilizes polyethylene as the base material, which allows for lower wave speeds and enables bandgap phenomena to occur at lower frequencies compared to traditional metals such as aluminum or titanium. Notably, the research presents a labyrinthine metamaterial design featuring a polyethylene-based unit cell, achieving effective acoustic control with a wide bandgap at low frequencies, specifically between 600 to 2000 Hz. A critical aspect of this research is the significance of tetragonal symmetry in elastic tensors, which affects the properties of these advanced metamaterials. The model introduces a term known as curl P in the kinetic energy density, facilitating the description of modes with negative group velocity, which may lead to negative refraction effects. The research outlines 4 distinct horizontal asymptotes for shear and pressure waves, differing from previous models that included more variables. Given the complexity of direct finite element modeling in structures utilizing these metamaterials, the study highlights the need for a homogenized model to prevent unsustainable computational demands. To validate the predictions made by the micromorphic model, numerical fitting parameters are systematically detailed. The authors summarize their findings and propose future research directions to further explore the capabilities and applications of these advanced materials, aiming to refine the relaxed micromorphic model for improved accuracy in describing wave dynamics through complex materials. Overall, the advancements in metamaterials discussed in this study enhance their physical properties and broaden their applications across various fields. MIT engineers have unveiled a revolutionary drug delivery method that utilizes tiny crystal suspensions, creating long-lasting drug depots under the skin. This development could significantly reduce the frequency of injections required for various medications. Funded by the Gates Foundation, the project specifically aims to enhance contraceptive options for women in developing countries, providing a simpler, long-acting solution. The innovative formulation allows for injections through a narrow needle and is designed to last between 6 months to 2 years. The contraceptive drug levonorgestrel has been used as a test case for this new delivery method. Initial tests conducted in rats indicated that these drug depots can remain stable for at least 3 months, retaining approximately 85% of the drug, suggesting extended efficacy. This system's simplicity opens up possibilities for treating a range of conditions, including neuropsychiatric disorders, HIV, and tuberculosis, with further studies planned for human applications. Researchers can control the drug release rate by adjusting the density of the depot using small amounts of biodegradable polymers, potentially extending the duration of drug effectiveness. The method employs a biocompatible solvent, benzyl benzoate, to suspend the drug crystals, facilitating the formation of a compact depot post-injection. Unlike previous injectable formulations that required large amounts of polymers, this new method minimizes polymer content, enhancing injectability while ensuring a long-lasting effect. Current injectable drugs typically require administration every 3 months due to rapid dispersion in tissue, underscoring the importance of this innovative solution. The research, led by Giovanni Traverso at MIT, included contributions from former postdoc Vivian Feig and graduate student Sung-Hyun Park, and was published in the journal Nature Chemical Engineering. This work is further supported by various fellowships and grants, including backing from the Gates Foundation and MIT's Department of Mechanical Engineering. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.